President Trump is getting pounded on CNN, pounded on what I call MSNBC hee-haw, because some states are reporting spikes in the number of coronavirus cases, and the president irresponsibly is ignoring how perilous this is. He won't wear a mask. He's just getting pounded. Now, my question is, are you worried about the uptick in the number of coronavirus cases being reported positive?
Well, of course, that is concerning. There's no question that's concerning. I think people are getting tired of being quarantined and being social distanced, and they want to live their life. So, yes, that is a bit of a concern to everybody. Look at there's 2.3 million cases in the U.S., 120,000 deaths. I think we have to identify, isolate, and do contact tracing. So it is a bit of a concern. You cannot say it's not a concern. Anybody who said it's not a concern, I think, would be sort of missing the boat.
Dr. Strom, the last time we talked, I believe you anticipated this. You said when people start going back to work, there are going to be increases in cases, and that is to be expected. Not to be welcomed or ignored, but certainly to be expected. I just find the contrast between what you said and what a lot of people said and the coverage of these spikes to be pretty startling.
Well, look, the numbers that everybody used to shut down were a lot more ominous. There was a death rate of 5 to 9%. They were taking the death rate by the number of cases. I told you that when the denominator is small and the death cases are rising a little bit, you're going to get a higher percentage. Now, we know probably in all comers that the death rate of this is probably under 1%. That's probably what's going on. And most of the death rates are happening in senior care facilities, nursing homes, the majority of them across the country. Just so you know, people over the age of 65, that's most of the death rate, probably 80%. So it's more of an older population. As I was discussing with my physician assistant, Ben, we're noticing that there are more cases, but they're mostly younger people. So the younger people are not getting as sick as the older people. So the majority of the death rate is from the elderly population. But we are seeing a rise. You know, look at people that are getting out, mostly are younger people. The older people are frightened. So we're seeing more cases, but it doesn't hit them as badly as it did the older population, Larry.
Dr. Kerry Strom is my guest. Dr. Strom, I understand that they are starting trials on vaccines in Africa and other places around the world. How confident are you that there will be a vaccine developed for the coronavirus in the near future?
Well, man, Larry, I think that's going to be the savior from everybody emotionally and physically as a vaccination. Mm-hmm. The drugs are just not there yet. We talked about hydroxychloroquine. I told you my feelings on that one. The remdesivir seems to be good, but what I'm understanding is the course of therapy is going to be about $5,000, so it's expensive. The vaccination the problem of this will be availability. It needs to be stored at a very cold temperature, and there are good numbers out there, good trials, but are we going to be able to make it on mass basis? That's the question. I'm hoping there's a vaccination soon because I think that's going to free everybody physically and emotionally in the U.S.
Doctor, the Wall Street Journal did a piece that compared the 8 states that did not have a coronavirus shutdown to the 42 states that did. And the 8 states are North and South Dakota, Nebraska, Iowa, Arkansas, Oklahoma, Wyoming, and Utah, all states that are not particularly densely populated. But it turns out they didn't shut things down, and their average unemployment fell lower than the average unemployment fell in the states that shut down. And their coronavirus cases were no higher, in some cases even lower, which suggests that maybe, just maybe, we would have survived this whole thing had we not had a national shutdown.
Yes, but I don't really believe that. I think that viruses are spread by contact. I mean, we can go back to 1918 when we had the Spanish flu. Look at those things came in waves. There were 100,000 deaths. 100 million deaths. I'm wrong. Mm-hmm. So I don't believe that, Larry. I think that you hit it on the head, that they're less populated. There are probably fewer nursing homes. There may be a younger population. Who knows if they were social distancing or wearing masks? But I think the density of the population is the reason there why the economies maybe have done better and let no lockdown.
Mm-hmm. Dr. Strom, one of the reasons that the president has been beaten up on CNN is that he has not worn a mask. I don't think I've seen him wear a mask anywhere. From time to time, Mike Pence has done so, but for the most part, the president has not. And the argument is that he's setting the tone. And if he is not wearing a mask, it gives young people the impression that this is really all that not all that serious, and they're less likely to practice social distancing, let alone wear a mask. Do you feel the president should be wearing a mask?
Yes, I think the president should be wearing a mask. I really do. As I told you on the segments before, that the mask is your friend. I think the president should be wearing a mask, setting an example to others, and honestly, the mask may help you as well. So I think that he's wrong not to wear it. He obviously has his reasons that he doesn't want to wear it. I think that anybody who's reasonable and thinking about this would be wearing the mask, especially when you're in contact with other people.
Dr. Strom, I haven't heard anybody point to China in a long time. Isn't it the case that China misled the world about the coronavirus, misled the world about the fact that it was transmitted human to human, and also arrested doctors that were telling the truth and destroyed samples that could have given us maybe a head start in developing a vaccine? If all those things are true, why have we stopped talking about China?
Oh, I don't know. I can't answer that. That's a non-medical question. It sounds to me like it's more political. And yes, I'm hearing the same thing, reports that you are. I don't know why we stopped talking about China. I'm sure that some of we don't know. We're hearing what we hear. We don't know firsthand. Assuming it's true, and maybe it's not true. Some of that information maybe it should have been told to the rest of the world. So why aren't we talking about China? I don't have an answer for that.
Dr. Strom, you only have a few seconds left. How worried are you going forward?
Well, I do believe that this thing is real. I am somewhat comforted that the death rate is going down, particularly in the state of California. The death rates are going down. The cases are going up. So it tells me that it's mostly younger people that are getting affected now, because those are the people that are out and about and maybe not be social distancing. Yes.
Dr. Kerry Strom, Associate Professor of Medicine at UCLA. Doctor, as always, thank you very much for taking the time.
All right. Thank you, Larry.